Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Ilham Shafiq bin Ahmad Nizam. My group and I will present about our company, which is Healthcare Pharmacy. Before we start to introduce our company, I will introduce about halal pharmaceutical first. There has been an increased need for halal awareness within the pharmaceutical industry. Many of us, including Muslims, rely on modern medicine to cure our various ailments. We rely heavily on the pharmaceutical industry. Without our knowledge, the medication we take may contain ingredients that are not halal or manufactured in a manner that is not aligned with Islamic values. Halal pharmaceutical products are steadily gaining popularity throughout the world and are setting a new standard of safety and quality. Over the past 2 years, this emerging niche market has witnessed sudden development and is estimated to reach $174.59 billion by 2025. Muslim majority countries have adopted a regulated framework that guides the halal certification process for pharmaceutical products. The expanding global Muslim population has increased the demand for halal pharmaceuticals. However, there are several challenges for this emerging niche industry, foremost of which is the need to establish a proper, well-regulated, and harmonized accreditation and halal management system. Third, halal pharmaceuticals in Malaysia. With more than half of its population composed of Muslims, Malaysia is a trailblazer in the certified halal pharmaceutical industry for its global halal pharmaceutical standards. In 2012, they produced the world's first halal certification for pharmaceuticals. Their new halal standard has expanded the scope of halal certifying bodies to address the demands in biologics and the search for halal vaccinations. Next, we go to the team management. Our team management is led by CEO Muhammad Shakirin bin Zakawi, and the following is I am the Executive Managing Director, and the Chief Financial Officer is Nurhanisa binti Kamaruddin, and the Chief Administrative Officer, which is Fatin Umniati Najla binti Ghazali, and the Chief Technology Officer is Fatin Filzana binti Surya, and the Chief Marketing Officer is Ummu Shuhada binti Azhar. And we got three internal committee, which is Internal Halal Committee, Risk Management Committee, and Audit and Integrity Committee. Next, we go to our company profile. Our company name, Healthcare Pharmacy Sdn Berhad, is one of the large-scale modern and traditional medicine, food supplement, and healthcare products that manufactured in Malaysia. We believe every person wants to live healthy and has the right to get healthcare that is excellent, accessible, and affordable. Thereby, we as an expertise in pharmaceutical are thirst to be produce an excellent product and services for our consumers. We are committed to adding modern cutting-edge pharmaceutical science to our comprehensive product range with the goal of optimizing holistic well-being at each stage of life. And then we go to our vision, mission, and value. Our vision is to be the pioneer in chemical distribution by raising customer loyalty through establishing strategic targets for improving quality and competitiveness and managing supply and demand in the dynamic market through the implementation of innovative growth strategies and business opportunities. Our mission is leading healthcare group providing quality and innovative solutions. Second, providing smarter solutions for a healthier life. And the last one is our major mission is to make every person to lead a healthy life and live longer with improved health. Our value is to assure that we consistently deliver the highest quality and trusted outputs and services. We believe everything is possible, and we inspire and energize everyone to be the best. Next, we go to the halal policy. The premise that want to apply halal policy must have the license from NPRA and fully required the requirement of GMP. And this halal policy is following the emission standard 2424/2019, which is halal pharmaceuticals general requirement and pharmaceutical product eligible to be certified halal as follows: scheduled poison products, non-scheduled poison products, over-the-counter, health supplement products, natural products, which is traditional and complementary medicines, and follow the Sale of Drug Act 1952, Control of Drug and Cosmetic Regulation 1984, and the last one is Drug Registration Guidance Document. This is our internal halal committee, which is led by our chairman Muhammad Ali, and the halal executive is Ahmad Shazwan, and the processing division department, which is led by Aisha, and the purchasing or procurement department is Abuza. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. I'm Fatin Aminati Najla and I will be explaining about the services provided and product description. Now let's begin. In this slide, I will be explaining about the services provided by the healthcare pharmacy. The first one is full service. Healthcare pharmacy offer a full service where they provide a complete and a wide range of medication and supplement that is needed for health concern. Next is monitoring prescription list. Another services that healthcare pharmacy provided is by monitoring the patient prescription list, where the pharmacist can help to extend or adjust the prescription. Other than that, they also help to track the patient updates after hospital visit and help to verify the potential drug reaction with. Third is free consultancy. Our pharmacies also offer a free consultancy for health and wellness. For question and consultation regarding patient prescription routine, the pharmacies are accessible. Last but not least is delivery services. Our pharmacy also provide a delivery service to patients resident, hence the pharmacy will be operating for 24 hours a day and open 7 days a week except for public holidays. In this slide, I will be explaining about the product description and intended use. Healthcare pharmacy provide a various of registered pharmaceutical product and medication. Some of the medication that our pharmacy offer is for allergy medication, for cough and cold, for family planning, for skin care, for constipation and diarrhea, for health and herbal supplement, and etc. The first one is allergy medication. For allergy medication, there is a cetirizine. Cetirizine is a product that is used to treat allergy reaction, which help to prevent the release of histamine. It comes either in a capsule or tablet. To consume it, take once per day. Next is for cough and cold medication. For cough and cold medication, there is paracetamol. Paracetamol is a product that is used in treating fever by lowering down the body temperature. It is also used to treat pain and discomfort such as headache, toothache, muscle pain, and menstrual pain. Paracetamol should be taken with a recommended amount. It should never exceed 4 grams per day of the overall dose. Other than paracetamol, there is also lozenge. Lozenge is a product which is in the type of medicated sweet where its function is to treat the irritation in the throat. The active ingredients that are in the lozenge give a different concern. To consume the lozenge, take it without water and suck it as it will dissolve in the mouth eventually. Now we are going to talk about the family planning. For family planning, there is the oral contraceptive pills, OCP, or mostly known as birth control pills. The function is to prevent pregnancy. For OCP to work effectively, it has to be consumed regularly during the same time. Next is skincare. For skincare, we have an evening primrose oil. It is a product that is commonly used in cosmetic and drugs. The function of EPO is to treat eczema, acne, psoriasis, and other condition that is related to the skin. To use the evening primrose oil, take 1 to 3 grams daily as recommended. However, for a greater dosage, you can seek advice from doctors and pharmacists. For next medication is constipation and diarrhea. For constipation and diarrhea, there is a laxative. Laxative is a product that is used to treat constipation by improving the frequency and ease of the stool transmission. This product is available in three types, which is tablet or capsules, sachets, and suppositories. This product can be taken with or without food. To consume this product, follow the direction that is provided at the packages. Last but not least is the health and herbal supplement. For health and herbal supplement, there is fish oil. Fish oil is a product that is rich in omega-3 fatty acid that is used to treat psoriasis and dry eyes, as it helps to reduce the swelling and pain. This product also used to treat condition that is related to the heart, as it also assists to prevent the clotting of the blood. To consume, take 4 grams daily as recommended by the pharmacist. In order to take a higher dosage, you can seek advices from pharmacists and doctors. Other than fish oil, there is also a vitamin. Vitamin in some chemical reaction in the body, vitamin serve as a catalyst to assist enzyme. To consume, it should be taken according to the dose that is allowed and advised according to the gender and age. To avoid any unwanted side effect, vitamin should not be taken above the recommended dosage.
I will now talk about the flowchart of our pharmacy. The first process step is procurement. It is including the controlled purchase of halal material. For example, the raw material that we receive is only a halal product. After that, the second process step is warehouse and logistics. In the storage, we need to separate the non-halal material and halal material. And the third process is the quality control. It is the process of verification of material according to halal requirement and specification. And the fourth process is production. It is to make sure the halal ingredient, the formulation is safe and is not intoxication, and also hygiene in all ways. This process also separate to 4 processes, that is proportioning, mixing, sampling, and granulation. And then next process is packaging. The process needs to have a suitable material for the packaging material. And the seventh process is the labeling. The process is needed to have a clear information for the labeling and correct information in the product label. The last process is the distribution. The process needs to have a separation of halal and non-halal material in the transportation. For example, using a transportation that distribute halal product only. Next is for the plan layout. The design are mostly from the Malaysian Halal Management System manual, that is MHMS 2020. And the green blocks is the path for the other section, and we have the section that store the raw material. And there were also the laboratory for the testing and for the sampling. And the other area is from the process area until the complete product store. We will also provide a prayer room for the Muslim worker to pray also.
Today I'm going to present about Halal Control Point Analysis Worksheet and the operation of Halal Risk Management Plan in our pharmacy. In this worksheet, it contains the process step, the least potential contamination, the rationale for inclusion or exclusion as a potential contamination, the evaluation of the likelihood and severity, impact of potential contamination, the control measure, and to determine whether the process step is a halal control point or not. The first process step is procurement. In procurement, the least potential contamination is non-halal source of ingredient from supplier, and the rationale is content of non-halal substance and ingredient in raw material. The likelihood is moderate, the severity or impact is critical, and the risk ranking is under number 8, that is under code significant. To control measure this process step is to inspect every receiving raw material, inform supplier and transporter regarding dedicated halal raw material, and carry out the lab analysis. and this process step is a halal control point. The next step is warehouse and logistic. In warehouse and logistic, the least potential contamination is contamination between halal and non-halal material. The rationale is using same equipment and tools in handling process of halal and non-halal material. The likelihood is unlikely, the severity or impact is moderate, and the risk ranking under number 3, that is under control, under law code. To measure this process step is to separate the equipment and area used for halal and non-halal material. This process step is a halal control point. The next is quality control. In this step, the least potential contamination is contamination between halal and non-halal material. Contamination affected on the halal specification of material is the rational, and the likelihood is unlikely. The severity impact is critical, and the risk ranking is under number 6, that is under code moderate. To control measure this process step is recheck on the CEO and halal certification, verification of sampling result on material according halal requirement and specification, and then this process step is a halal control point. The next step is production. In production, there's 4 another little step, that is proportioning, mixing, granulation, and compressing or filling, and sampling. In proportioning, there's no least potential contamination, and this process is not a halal control point. And next, for mixing, it is to the least potential contamination is usage of critical ingredients such as collagen and alcohol. The rationale is critical ingredient not following halal specification, collagen from non-slaughter animal, and alcohol made from wine processing. The likelihood is evaluate on likely, the severity or impact is under moderate, and the risk ranking is number 7, that is under code significant. The control measure this process step is verification of all critical material according halal requirement and specification, and this step is a halal control point. So next, we go to granulation and compressing filling. In this process step, the least potential contamination is usage of critical ingredient in capsule. The rationale is capsule contain collagen from non-halal source, and the likelihood is likely. The severity or impact is under critical, and the risk ranking is under number 9, that is high. To control measure this step is to verify the ingredient used in capsule, and this step is a halal control point. For the sampling, there's no least potential contamination because it is already being verified in the mixing and granulation process. So the sampling process is not a halal control point. The next process step is packaging. In packaging, the least potential contamination is packaging using non-halal material. The rationale is packaging material contaminate with non-halal substance, and the likelihood is unlikely. The severity or impact is under moderate, and the risk ranking is number 3 under code law. To control measure this step, it is to inspect on halal packaging material, and this step is a halal control point. The next step is labeling. Labeling may contain labeling are not following requirement in MS 2424. And the rationale is not enough information stated on the product label. The evaluation of likelihood is unlikely. The severity or impact is insignificant, and the risk ranking is under number 1, that is low. The control measure for this step is verify on labeling using clear and relevant information. This step is a process. This process is a halal control point. And lastly, for the distribution, the least potential contamination is contamination between halal and non-halal product. And the rationale is using same transportation in distributing halal and non-halal product. The evaluation of likelihood is unlikely. The severity or impact is under insignificant, and the risk ranking is under number 1, that is low. To control this process step is to use different logistic company for halal product to inform distributor and transporter regarding dedicated halal product, and this process step is a halal control point.
The halal risk management plan summary for our pharmaceutical company. Okay, so I would like to present about the HCP number 1 until the last number of HCP, the process step, what to monitor, how to monitor, frequency of monitoring, and who need to monitor, the corrective action, also the verification and the records. Okay, so for the HCP number 1, which is procurement, what to monitor is the raw material, and how is by inspection and sampling. The frequency is every procurement process, and who need to monitor is the procurement manager and halal executive. The corrective action is by return the raw material to supplier. Okay, so for the verification, the procurement manager and halal executive need to inspect the raw material and carry out sampling in every procurement process. The record is the invoice of any company or supplier that supply the raw material. Okay, for the second HCP, which is HCP number 2, warehouse and logistics. Okay, so what to monitor in the warehouse and logistics is the equipment and tools. How to monitor is separate the equipment in and tools. Okay, so the frequency is every handling process. Who need to monitor is warehouse manager. The corrective action is by sell-to process. Okay, for the verification, warehouse manager need to separate equipment and tools in every handling process. So the records is documentation of sell-to process. If any contamination occur in the process of warehousing and logistics, they need to carry out the sell-to process to make sure there are no contamination. Okay, next for the third HCP, which is HCP number 3, quality control. What to monitor is the raw material. How, which is by check and verify the COA, and it is monitored in every production process, and the person need to monitor is the quality control manager, which is QC, and the corrective action is to return the raw material to supplier. Okay, and then the verification is quality control manager need to check and verify the COA of raw material in every production process. It is to make sure there is no contamination to the raw material and to control the quality of the raw material. So the record needs is COA, which is the certificate of analysis, and the lab analysis report. Okay, so the HCP number 4, which is production, in the mixing stage, the things that to be monitored is critical ingredient, for example such as the collagen and alcohol used in the pharmaceutical product, and it is how to monitor is by verified following the halal requirement, and it is monitored in every mixing process by the QC and production manager. Okay, so the corrective action is batch recall. So if any problem in the batch, so the batch need to be recalled. Okay, so the verification is QC and production manager need to verify the critical ingredient such as collagen and alcohol following the halal requirement in every mixing process. Okay, so the records needed is the COA, which is Certificate of Analysis, and the lab analysis report.
I will also talk about the HCP5 until 8. The HCP5 is production that under granulation and filling. What are needed to monitor? It is the granulation of the critical ingredient in the capsule, and to monitor it is to analyze the source of the capsule ingredient in every filling process. It is also monitored by the QC and the production manager. The corrective action for this HCP is changing of capsule supplier. The record is only COA, that is Certificate of Analysis. Next, HCP is packaging. The packaging material need to be analyzed, the material of it in every packaging process by the QC manager. The corrective action is changing the packaging material, and the record for this HCP is invoice of the packaging material. The HCP is number 7 is the labeling. The product label need to be submitted to the label design for the improvement, and it is done before the label printing. This step need to be monitored by the marketing manager and halal executive. The corrective action for this product is to correct the information in the product label that is not follow the requirement or something that doesn't in the product. The record in the product label and the approval from the halal executive. The last HCP is 8, that is distribution. The finished product had a proper handling that in every distribution process. It should be monitored by the halal executive for this HCP. The corrective action is to change the logistic company or the distributor. The record is the invoice and the traceability system that already implanted in the product.
Hi, let's move on to the standard operating procedure in our company. First is the traceability system. Our traceability system involves 3 phases, which pre-processing involve a procurement process, warehouse and logistic, and the quality control. For the processing phase, include the production process, packaging process, and labeling process. For the post-processing, include the distribution, which means in distribution will involve a logistic, and this logistic must have their own traceability system, so the food recall can be done easily. We also have a recall decision flowchart. So first, customer complaint. After customer complaint, we will do a identification of non-conformance report, which means we identify the potential product and the non-conformance issue, and then we will inform to the quality unit. After that, we will do a recall assessment. It means we inform to the consumer or the customers for the recall action, and then we do a follow-up inspection. Follow-up inspection means we do a corrective action, and then we do a documentation. Documentation is for the follow-up session, which is monitor the process of the next product, and we also do a mock recall. So this is our mock recall. We do it in 3 days, okay, and we do at least once in a year. We go to the halal training. Halal training in our company will be provided according to the program related in halal matter. In our company, the internal halal committee members are halal executive, quality assurance, production members, procurement, and also logistic. This table is the list of training requirement for particular participant. So I give you one example. The type of training is halal awareness training, and the participant involve all staff in our company, and we do it at least every 4 months, and the trainers is our halal executive. Next, for the Cert 2, our Cert 2 method is according to the MS 2400 2010, and for this Cert 2 activity, it must be monitored by the JAKIMS authority or the authority body. So we also have a Cert 2 frequency. The person in charge who do the Cert 2 must have a documentation or a report. Next, the laboratory analysis. The laboratory outcomes based on the implementation using a detector method. It can be seen as evidence of proper labeling,
or as a verification whether manufacturers are currently supplying products without haram substance. So this is our analysis. For the haram ingredient we can find is from the fat from animals. The identification is the fat composition, which fat from vegetable or part poultry. And the example of method we use is electronic nose technology. We move to the internal halal audit. So this is our internal halal audit process. First, we must have the opening meeting. We have audit planning and preparation. After the process, we must have audit execution, which have adequacy audit or on-site or compliance audit. For if the NCR are found, so it must go to the corrective action. After corrective action, then we do a follow-up audit. And if there are no NCR found, we can close the meeting. So, audit execution, as I mentioned earlier, there are two types of audit used in halal auditing. For the first on-site compliance audit, the program will include opening meeting, plan visit, documentation comments, and closing meeting. If there are any corrective action requests, it will be presented during the exit or close meeting. So, for the adequacy audit, it is to examine the document in the halal file from our product, and then to examine the supportive document, for example, the product specification and halal certification. It is to verify that all elements are according to MS 1500 2019 and halal principle as required by the Sharia law. The checklist is important as an evidence or reference that we have conduct an audit. And lastly, before we conducting the audit, first of all, our company will have a meeting explaining what to do, define the criteria, and do a checklist, and so on.